So hi everyone, we continue again on ORS. So as I said, there's an indication for ORS. You don't just give ORS anyhow, and you don't just prepare it anyhow. Okay, ORS, the traditional method of preparing it is to mix salt and water, and salt and sugar and water. Okay, these are the components of ORS. It contains glucose, it contains salt, it contains the potassium. Okay, so it is prepared, it is in the right quantity. If you use the ORS, it's given in the right quantity. So, and the ORS is very affordable. Okay, it's very affordable. This is like 200. It's very affordable and it's accessible to everyone. You can get it over the counter from a pharmacy. Okay, and you prepare it and take. Do not give an unconscious patient this. Do not give a severely dehydrated patient this. That's what I said. Okay, so but you have to know how to prepare it. Hygiene is very important. The hygiene is very important when you are preparing ORS, because you don't need to pass the bacteria from one person to the other. Because maybe if you're having diarrhea in a house, you can pass it by just not washing your hand, or not ignoring simple hygiene techniques like hand washing. So you can use the toilet or use the restroom, then you come, you don't wash your hand, you touch surfaces, and then the other person in the house also touch, and then it's transferred, the bacteria transfers. So it's important, first of all, you take care of your personal hygiene first before you start preparing this ORS. Okay, so how do you do that? First of all, hand washing. It's very cheap and it's very important. You wash your hands with soap and water. Okay, wash your hands properly with soap and water before you prepare. Okay, you wash your hands and you rinse. Okay, water. Okay, you rinse very well. Okay, now for children who are breastfeeding, it's important you continue to give them breast milk very frequently. Okay, when there's stooling, give breast milk. Do not stop giving breast milk. Give breast milk as much as possible. Also, do not stop for children who are not breastfeeding. Also, give them food to eat. If whether they vomit it or not, give them food to eat. As far as they are eating, give them food to eat. Even if they vomit it to eat, give them food so that they will continue to eat. They will continue to replace the lost fluid. The goal here is to replace lost fluid. So you don't need to stop giving them food. Don't need to stop giving them breast milk. Okay, it helps them. It helps them to rehydrate. Okay, so you use this water. This is 1.5 liters of water. This is 150 cl of water, so 1.5 liters. Okay, the recommended quantity of water to use is 1 liter. So you use this as a basis. When you use it, you can buy this. Okay, you can buy this one, then you open, or you boil water. For those who will not have access to clean water, you boil water and allow it to cool, then you pour. Okay, you pour in this container. Okay, then because it's 1.5, I'll be reducing it to get the right quantity. You reduce it to the first line to get the right quantity. Okay, reduce it like this. This is there. Yeah, we're there. That's 1 liter. Okay, now this is my ORS. Okay, you cut. Okay, you turn everything. For children, give them every loose stool, you give them 150 to 100 mils for children. Okay, so in a day you are giving them like 8.5 cups of this to drink. Okay, for every time they stool, you turn it inside. Okay, you turn it inside like this. Okay, turn everything. You turn everything inside of it like this. Okay, then you cover. Okay, so reduce the water to this amount. The first line, if you are getting Nestle water or getting Swan water, you reduce it to the first line. Then you shake. Anytime you want to give, shake very well. Okay, before you give. For adults, they are meant to consume this at least 2 liters of water in a day, ORS in a day. Okay, to replace lost fluid. Okay, so you give this and you give zinc once a day. Give zinc once a day. It comes in 10 milligram, it comes in 20 milligram. So give 1 tablet of zinc, because I told you zinc helps in reducing the level, the severity of the diarrhea. Okay, and this also, it helps. It helps in replacing lost fluid, like sodium, like glucose. Okay, like potassium. Okay, so this contains this. So this, I told you, is affordable. You can get it anywhere. You can buy it from the pharmacy. You can buy it from anywhere. You can get it over the counter. It's very cheap, and you don't need any special technique to prepare it. I told you, you get water, this water, and reduce it to this level to make it 1 liter of water. Then also, you can discard this after 12 hours. If you keep it at room temperature, you discard it after 12 hours of consumption. If the child doesn't consume after 12 hours, discard and make another one. Okay, if you put it in the fridge, you can take it for 24 hours. But once it's at room temperature, you discard and 12 after 12 hours and make another one again. So it's very simple to prepare. So if you have anyone, or if you are dehydrated, or you have a child, especially because I'm emphasizing on children, because children, you lose children mostly to this every day. Okay, 7.8 million children die worldwide to this diarrhea. So it is very important you vaccinate your child with the rota vaccine, and also you take precautionary measures, and also ensure hygiene, good hygiene. Hand washing is very important. You bath very well, you wash your hands properly before handling items, before feeding your child. Okay, to prevent this diarrhea from happening. Okay, and check what you eat, check what you give your child to eat. So it's very important. So preparation of this is simple, it's affordable, as I said. Okay, but do not give to those who have hypertension. Do not give to those who are restricted from taking salt, high salt intake. If you notice any swelling, any puffy eyes, any puffy body, please report to the hospital or stop the ORS, because it means there's overload, there's salt overload in your body. So nothing. It has side effects. It can lead to abdominal cramps. It can lead to nausea. You can feel nausea. You can feel like vomiting. Okay, but please do not stop taking. It's not very nice, pleasant in the mouth, because it's salty. Most children might not want to take it. But if your child is sick, he's dehydrated, please and please try and give this before you go to the hospital or anything. Just have this around your house, because I said you can get it from the pharmacy. It is very easy to prepare with clean water. You can buy this water. Okay, you can put pure water to this level and make it prepare. Anytime you want to give, shake and give. Okay, you can give a whole day, so that the child will get his strength back. As he's losing fluid, he doesn't lose fluid completely. He gets from this. Please do not keep your child at home and claim ignorance. I hope I'm understood by the way of preparing this. Okay, you don't just put it in water, in any kind of water. Please, 1 liter of water is recommended. And also shake anytime you want to give. Just turn it inside and wash your hands properly. I hope this video helps you. You can share it to those who have children. You can share it to those who are around you to help them. So see you in my next video. Bye for now. Thank you.